A couple points that you want to keep in mind. Number one, if your patient comes in with one stress fracture, so this would be their first stress fracture they've ever had, that's when you can look at their biomechanics and figure out which type of stress fracture it is, and we'll get into that in a second. However, if your patient comes in, and you will see this often with female athletes, with multiple stress fractures, so they've had one in their foot, they've had one in their hip, you really have to do a full blood work, comprehensive panel with them, because a lot of the times with multiple stress fractures, there can be some type of nutritional deficiency. So that's going to be a referral into their PCP or whoever you work with. There are two different types of stress fractures that you need to be aware of, because based on their location, that is going to alter treatment. So the first type of stress fracture that we're going to discuss is a compressive load. And I think those are the ones where I think we're the most comfortable with, and that's simply load, right? So if I am walking and I keep compressively loading my heel and I don't have good calcaneal eversion, for example, so I have a rigid foot, a very rigid foot type, and there's just a lot of pounding going on, that can start to stress the bone, and you'll have compressive loaded stress fractures. So the locations for those, think your calcaneus, the lateral column of the foot, so occasionally in the fifth metatarsal. The other type of stress fracture is tensile strain. So those types of stress fractures are a result of not compression, but an inability to control things, or a lack of stability. So for example, the navicular, okay, is a place where you would get a tensile strain stress fracture. The navicular never touches the ground, or it shouldn't. So when someone's coming into the ground and they don't have good control of rotation, they start to get tugging at the navicular. And it's this tugging, because they can't control the amount of rotation, that starts to have the stress reaction in the bone. So navicular, the second and third metatarsals, same concept. Can't control rotation, don't have a lot of stability at the foot, and you start to get those types of stress fractures. The tibia, inability to control rotation. The femur, same concept. So being able to identify where the stress fracture is, and also what type it is going to help better define your treatment. Compressive loaded stress fractures, you're going to need to what? They might like to have cushion underneath the heel, but the ones that are tensile strain fractures, you really better look at stability of their system, because there's a reason that they can't control their movement.